Diabetes is an emerging global epidemic. It is a disorder that leads to insulin resistance at the cellular level. Muscle, fat, and liver cells require insulin to absorb glucose from the blood and change it into energy.
Total deaths from diabetes are predicted to increase by more than 50% in the next 10 years.
There are two major types of diabetes that people have. There is type 1 diabetes, which is characterized by a lack of insulin production, and type 2 diabetes, which results from the body's ineffective use of insulin. Type 1 diabetes is caused by genetics, and type 2 is caused by an unhealthy lifestyle. People with type 1 diabetes can get treatment through insulin pumps, which are small computerized devices that deliver insulin in a steady, measured, and continuous dose, or the surge dose, around mealtime. People with type 2 diabetes can exercise and eat healthier.
People with diabetes differ from someone who don't, because diabetics have to check their insulin and blood sugar levels. However, they're the same because they both are conscious about what they eat and the amount of exercise they get.
Many people with diabetes want to be treated no differently than others and want others to know that they are not helpless.
Hi, I'm Dr. Catherine, and I see that you've recently been tested for diabetes. Do you have any questions in particular about diabetes?
I'm still unsure about what insulin and glucose have to do with my body.
Okay, so diabetes causes our bodies to have high blood sugar levels. When we eat, we consume sugar, which is glucose. Once the glucose enters our bodies, our cells need it to create energy. But in order for our cells to know that glucose is in our bloodstream, our pancreas creates insulin, which should alert the cell. For diabetics, glucose is flowing around the bloodstream rather than entering the cell.
Alright, on my last visit I told you how I have blurry vision, excessive urination, thirst, and tingling in my feet. And then you had me take a glucose tolerance test where it proved positive for diabetes. How do I know if I'm type 1 or type 2? And do these symptoms correlate with diabetes?
I will have you take an insulin tolerance test if you can come back in tomorrow.
Yeah, that'd be great.
Okay, so by judging what you told me on your last visit, that you do not exercise nor do you eat the healthiest foods, and you do not know of any family history of diabetes, I am leaning towards that you are type 2. And yes, those are typically the symptoms that indicate that an individual has diabetes.
But now that I know I'm a diabetic, how should I change my diet? Are there any treatments I can take? Could I have prevented this?
I recommend that you limit sugary foods and beverages. Also eat a variety of healthy foods such as vegetables, whole grains, fruits, non-fat dairy products, beans, lean meats, poultry, and fish. You need to watch the amounts of fats, cholesterol, sodium, and sugar you are consuming. Also make sure to eat the right amounts to fulfill their daily values. There are a couple different kinds of treatments such as a lifelong commitment to blood sugar monitoring, healthy eating, regular exercise, and maybe diabetes medication or insulin therapy. But I suggest that you monitor your weight, eat healthy, and exercise regularly. There are also a variety of prescription medications that you can take. Most are oral medications that fall into categories. Some include medications that decrease glucose production and increase insulin sensitivity, while other medications slow the breakdown of carbohydrates. And to answer your last question, yes, as a type 2 diabetic, you could have prevented this disorder if you live by a healthier lifestyle. You can also visit biomedical professionals such as a food technician, dietitian, and certified diabetic educator. A food scientist would have extensive knowledge on food and how certain foods affect your body. They could work with a dietitian who could recommend foods that help your body. A certified diabetic educator could also educate you further with diabetes about what else you could do to treat and improve your condition.
How should I exercise, and why is it so important that I stay fit?
Exercising and staying fit can lower your blood sugar and blood pressure, as well as improve your body's use of insulin. With this regular exercise and healthy diet, you can cut down or even eliminate certain medications. To live with this disorder on a daily basis means that you have to revolve your schedule around this disorder.
Are there any habits or routines I should follow?
Routines and habits that must be followed include exercising, monitoring your blood sugar levels, as well as watching what you eat. You must do this every day. Your loved ones may also have to revolve their life around diabetes in order to help the affected patient.
I'm just worried that I won't get enough exercise or eat healthy enough to reverse my diabetes.
You will as long as you eat what is recommended and exercise at least 30 minutes a day. If you don't, however, it could lead to kidney disease. Your kidneys work hard to filter out extra sugar in your blood. After many years of working, however, they start to become damaged, which is also called diabetic nephropathy. If your kidneys aren't able to function and filter out the waste in your body, you will need to get a kidney transplant.
Thank you for answering all my questions today. I'll see you tomorrow for my insulin tolerance test.
Hey Shia, how are you?
Good. Life with diabetes is bearable. Watching what I eat is hard, and remembering to take my blood pressure is harder, but I think exercising is the easiest part, and I'm really enjoying it.
great to hear. I hope you can reverse this disorder.
Thanks.
Bye now.
Bye.